Hi, my name is Brittany Red, and my presentation is on chronic depression. Chronic depression is defined as having severe symptoms that interfere with a person's ability to work, sleep, study, eat, and enjoy life. Symptoms of major depression can include fatigue or loss of energy, feelings of worthlessness or guilt, impaired concentration, loss of interest in daily activities, appetite or weight changes, sleep changes, and recurring thoughts of death or suicide. Depression is a disease that affects all genders, ethnicities, races, and people from all walks of life. The disease is a multifaceted and can be attributed to genetic causes, various psychosocial and environmental stressors, and can accompany other diseases and disease processes. Locally, 21.5% of adults in Utah County have depression. Statewide, 23% of adults in Utah suffer from depression. Nationally, 19.1% of adults in the U.S. suffer from depression, and internationally, 3.4% of adults suffer with depression. Utah consistently has higher rates of self-reported lifetime depression and doctor-diagnosed depression than the U.S. rate. Various reasons have been suggested for having an impact on Utah's higher rate of depression, but nobody really knows why. Factors that may play a role in Utah consistently having a higher rate may include the problem that mental health needs are growing rapidly, but the number of mental health counselors and depression treatment centers are not meeting the demand. The shortage of mental health care providers and counselors make it hard for people to gain access to depression treatment in a timely manner. Other factors may include high birth rates, altitude, religious views and expectations placed on individuals, and a perfectionist viewpoint. Contributing factors, social detriments of health. What are social detriments of health? They are the social, economic, and health conditions people are born into and live. Poor social and economic circumstances affect people's health throughout life. Some of the contributing factors to depression can include social, economic, and health conditions which they are born into and live, economic stability and income level, social and community support, neighborhood environment, education access and quality, healthcare access and quality, and chronic diseases. Economic stability and income level may be the most significant social detriment of health issue because it determines one's overall living conditions, affects one's psychological condition, and helps shapes a person's diet and eating habits, and can affect their access and ability to affordable health care. Social and community support and good social relationships make a big impact on health and the prevention of depression. It gives a person the emotional resources they need. Good social relationships can reduce depression because it makes people feel cared for, loved, and valued. Neighborhood environments can affect access to healthy food, healthcare, safety, and education. Chronic diseases can make a person more susceptible to and bring on depression. Contributing factors, specific concerns. Depression is a complex condition and its causes are not fully understood. Various factors can lead to depression. These can include biological factors, psychological and social factors, unemployment, life changes, and other things. Depression can impact everyday life, causing low mood, loss of interest and pleasure, feelings of guilt, of low self-worth, disturbed sleep and appetite, low energy, and poor concentration. Some of the root causes of depression can be hormone imbalances, stress, trauma, or going through a major life change, chronic diseases, lack of resources, genes, lifestyle choices, inflammation, Depression is usually a complex issue involving many root causes that need to be addressed simultaneously and from many different angles. It may be caused by a combination of genetic, biological, environmental, and psychological factors. Everyone is different, but some factors or root causes may be what we have discussed. Treating the person as a whole and getting to the root cause will give you the best result. Contributing factors in Maslow's hierarchy of needs. Maslow's hierarchy of needs demonstrates that until basic fears and needs are addressed in someone with depression, no progress will be made towards the upper needs in the model. Achieving these higher needs could be viewed as the ultimate goal of treatment for depression. The levels of esteem, love, and belonging needs are relevant to someone with depression. Due to the nature of depression, the person will feel low levels of self-esteem, confidence, and achievement, and so will be unable to fulfill this need. People with depression often become isolated and unsocial and feel as though no one understands them, loves them, or cares about them. Therefore, they will have a great difficulty fulfilling the need of love and belonging. If safety is unmet, PTSD may occur and cause depression. A conscious implementation of Maslow's hierarchy may increase the levels of motivation in someone with depression, therefore enhancing the outcomes. Chronic depression impacts multiple areas of functioning. It usually affects the ability to perform activities of daily living, the ability to form and maintain interpersonal relationships, and work capacity and productivity. Communicable diseases or infections. People with chronic depression may be more susceptible to communicable diseases as they lack self-worth, self-esteem, confidence, and more. This may lead to them putting themselves in vulnerable situations, seeking for love, acceptance, and self-worth in the wrong way. If they have a communicable disease, that might initiate the depression. And if they get a communicable disease, that can make their depression worse. It can be a domino effect altogether. Depression is a serious disorder that can take a terrible toll on you and your family. Depression often gets worse if it isn't treated, resulting in emotional, behavioral, and health problems that affect every area of your life. Depression is associated with an increased risk of the onset and progression of chronic diseases, such as autoimmune and cardiovascular disorders, as well as potentially an increased risk of acute conditions such as infections. An example of this is depression can lead to excess weight gain or obesity, which can lead to heart disease and diabetes, or vice versa. Chronic diseases can lead to depression. Specific concerns in self-care and self-harm. Some people who have chronic depression lack the motivation to take care of themselves and may think of hurting themselves or committing suicide. It is important to call your mental health provider if you're having these problems. Get help from your primary doctor or other healthcare providers. Reach out to a close friend or loved one. Contact a spiritual leader or someone else in your faith community, or reach out to the different crises and hotlines. Research has indicated that people who are depressed are particularly vulnerable to being victims of violent crimes. They are more likely to self-harm rather than harm others. People with mental illness are at a higher risk of experiencing multiple forms of violence. Thank you for listening to my presentation.